Hello everyone, welcome back to this channel. This is the third episode of Target Nursing Officer exams, and before we move on to our discussions, let's start with some motivational quotes. Whatever your life's work is, do it well. Question number 1. Respirations which are abnormally shallow for 2 or 3 breaths followed by irregular period of apnea is termed as option A, Biot's respiration, option B, chain-stroke respiration, option C, Kussmaul respiration, option D, hypernia. Correct option here is option A, which is Biot's respiration. Biot's respiration is the respiration is type of abnormal respiration which have shallow breath for 2 or 3 breaths followed by irregular periods of apnea. And chain-stroke respiration, it's a pattern of crescendo and decrescendo respiration followed by period of apnea. And if we draw the graph it will be like this. This is the pattern of chain-stroke respiration, and in Kussmaul respiration you usually have a tachypnea, and hypernia. That means in Kussmaul respiration the person will have increased rate of respiration as well as the depth will also be increased. So if the graph of respiration, it will be like in this type, will be this type in Kussmaul respiration. And hypernia means the increase in depth of respiration. The rate will be normal, but the depth will be increased. If we plot the graph, it will be like this. Question number 2, the staining method for demonstrating the tubercle bacilli and the atypical mycobacterium is option A, Albert stain, option B, Ziehl-Neelsen stain, option C, Gram stain, option D, Ponder stains. Option A, Albert stains, is used to demonstrate Corynebacterium diphtheria. And Ziehl-Neelsen stain is used to demonstrate this acid-fast microorganism like mycobacterium. Gram stain is used to identify or demonstrate between gram positive and gram negative bacteria. And Ponder stain is also used to demonstrate this Corynebacterium diphtheria. So the correct option here is option B, which is Ziehl-Neelsen stain or ZN stain. Question number 3. Pneumocystis carinii pneumonia is an infection commonly seen in patients with option A, hepatitis B, option B, AIDS, option C, COPD, option D, SLE. Pneumocystis carinii pneumonia, also called as Pneumocystis jirovecii pneumonia. It is a type of fungal. It is a fungal infection that affects mostly the immunocompromised patient. So here we see in the option B, AIDS. In AIDS, we know that patients usually are immunocompromised. So the correct option here is option B, which is AIDS. Question number 4. When a new microorganism causes an infection in a host whose resistance is lowered by the existing infection is termed as option A, reinfection. Option B, secondary infection. Option C, nosocomial infection. Option D, opportunistic infections. Correct option here is option B, which is secondary infection. Secondary infection, it is the type of infection in which a new organisms causes infection to the host who's already infected by the other organisms. Reinfection means it's a type of secondary infection caused by the same. It is a secondary infection caused by the same organism or same type of agent. Nosocomial infection, also called as hospital acquired or healthcare acquired infection. This type of infection is acquired during the process of receiving care in the hospital, in which the infection was not present at the time of admission. And opportunistic infection is the type of infection which usually people with immunocompromised get infected. Question number 5. What is the primary role of anganwadi worker in the community? Option A, supplementary nutrition for children. Option B, diet training. Option C, supervision of health guides. Option D, control of communicable disease. The correct option here is option A, which is supplementary nutrition for children. That is the primary role of anganwadi workers. Question number 6. Odynophagia is a term which means option A, difficulty in swallowing. Option B, painful swallowing. Option C, indigestion. Option D, regurgitation. Correct option here is option B, which is painful swallowing. Painful swallowing in medical term is called odynophagia. Difficulty in swallowing is called dysphagia. And indigestion is called dyspepsia. Question number 7. An ethical principle which focuses to keep promise is called option A, beneficence. Option B, fidelity. Option C, accountability. Option D, confidentiality. Option A, beneficence. Beneficence means in nursing, this ethical principle means the act of kindness. For example, how the nurses demonstrate this principle? By holding the hand of a dying patient. Fidelity means faithful or loyal. So in nursing, the fidelity means like the nurse keep promise to the patient. For example, the nurses promise the patient that she will come back in 30 minutes to assess the pain of the patient. So after 30 minutes, either that nurse who promised the patient should come, or she or he may delegate order to check on the patient's pain. Option C, accountability. Accountability in nursing is to use it means like the individual or the nurse are responsible for their actions and obligated to explain to the supervisors or to the seniors. Confidentiality, it is the right of in nursing, it means like in nursing, confidentiality means the personal or the medical information of the patient is kept private or confidential. So the correct option here is option B, which is fidelity. Fidelity is an ethical principle which focuses to keep promise. Question number 8. The process by which glucose is made primarily in the liver from non-carbohydrate sources is known as option A, glycolysis. Option B, glycogenolysis. Option C, gluconeogenesis. Option D, glycogenesis. Option A, glycolysis means a breakdown of glucose. It is a process of breakdown of glucose to extract energy for cellular metabolism. Glycogenolysis means It is the pathway or biochemical pathway in which the glucose is breakdown, in which the glucogen is breakdown into glucose 1-phosphate and glucose. Gluconeogenesis means it is the process of synthesis or formation of new glucose from non-carbohydrate sources. Glycogenesis means it is a process of formation of glycogen. So the correct option here is option C, which is gluconeogenesis. Question number 9. A subjective feeling that an experience which is occurring for the first time has been experienced before is called option A, euphoria, option B, deja vu, option C, confabulation, option D, hypnosia. Correct option here is option B, which is deja vu. Deja vu is a condition in which the person feel that the situation which is happening now, he has already experienced it before. And what is euphoria? Euphoria is it's a state in which a person has great happiness, like a person feeling of great happiness is called euphoria. And confabulation is a type of neuropsychiatric disorders in which the persons try to fill the memory gap with the imagine or untrue experience, sometimes false memory. And hypnosia, also called as hypnosis, also hypnosis, also known as hypnotherapy. Question number 10. A type of organelle of the cell which is responsible for natural defense of the body is option A, ribosomes, option B, mitochondria, option C, lysosomes. Correct option here is option C, which is lysosomes. Lysosome, it helps in the defense of the body by breaking down or digestions of the outside molecules. And ribosome, it is the site for protein synthesis, and mitochondria is also known as the powerhouse of cell, because it helps in turning the energy which we take from the food into the energy in which the cells can use. Question number 11. Which among the following is a non-modifiable factor of coronary heart disease? Option A, smoking, option B, obesity, option C, age, option D, stress. The question asked is about the non-modifiable factor, so the correct option here is option C. Age cannot be modified, so age is a non-modifiable factor, whereas smoking, obesity, and stress can be modified. That's why it's called modifiable factor. Question number 12. Fluid-filled skin lesions are called option A, macule, option B, papule, option C, vesicles, option D, abscess. Correct option here is option C, which is vesicles. Vesicles are a small sac formed by membrane and is filled with fluids or with liquids. So correct option here is option C. And what are macules? Macules are the flat distinct discoloration in the skin. Discoloration of skin is called macule. Papule are solid or cystic raised spot in the skin. And abscess is collection of pus either in the tissue, organs, or any confined spaces of the body.